Welcome to Simi's exam platform. In this video, we are going to discuss some nursing clinical based questions with answers and explanations. These questions are very useful for your nursing education and government exams like JIPMER, AIIMS, RRB and etc. Let's go to the video. First question. Nurse Ramya is providing care for a patient who is newly confirmed with colon cancer. The patient has become withdrawn from his family members. Which of the following nursing action is most appropriate for this patient? Option A. Approach the doctor and recommend a psychiatric consultation for the client. Option B. Motivate the client to verbalize feelings about what he feels internally. Option C. Give health education regarding available new treatment with successful outcomes. Option D. Ask family and friends to visit the patient and enhance emotional support. Answer is option B. Motivate the client to verbalize feelings about what he feels internally. Explanation for the question. A newly diagnosed patient with cancer may experience a range of emotions including fear, anxiety, and sadness. It is important for the nurse to create a supportive environment and encourage the patient to express their feelings and concerns. By motivating the client to verbalize their emotions, the nurse can help facilitate open communication and provide emotional support. Option A is also may be considered if the patient withdrawal and emotional state persist or worsen over time. Second question. You are taking care of an adult patient who is on synchronized intermittent mandatory ventilation mode, that is SIMV mode. To keep the airway patent, doctor recommended for the open suctioning procedure, which is to be performed every 4th hourly. Before doing the procedure, you have checked the patient unit and the suction apparatus for proper functioning. What pressure you will set on the wall mounted suction apparatus for performing suction on this patient? Option A 50 to 100 mmHg. Option B 100 to 150 mmHg. Option C 150 to 200 mmHg. Option D 250 to 300 mmHg. The answer is option B 100 to 150 mmHg. Explanation. The wall-mounted suction apparatus is used to remove secretion from the airway. The suction pressure should be set at a level that is sufficient to remove the secretions without causing harm to the patient. In the case of an adult patient who is on SIMV mode, the suction pressure should be set at 100 to 150 mmHg. Third question. 25-year-old woman suffers from postpartum hemorrhage on her second postnatal day. Her APTT and PTT are prolonged while BTPT and platelet counts are normal. Likely diagnosis is dash. Option A acute hemophilia. Option B lupus anticoagulant. Option C disseminated intravascular coagulation. Option D inherited congenital hemophilia. The answer is option A acute hemophilia. Explanation. Acute hemophilia is a rare condition characterized by the development of antibodies called inhibitors against clotting factors, most commonly factor 8. It can occur in individuals with no previous history of bleeding disorders. Acute hemophilia is often associated with prolonged activated partial thromboplastin time, that is APTT, and prolonged partial thromboplastin time, that is PPT, due to the presence of these inhibitors, while other clotting tests such as bleeding time, prothrombin time, and platelet counts remains normal. Fourth question. A patient who is a heavy caffeine user has been NPO all day. He is scheduled for surgery in the evening. The nurse monitors the patient for effects of caffeine withdrawal that may include all except option A headache, option B drowsiness, option C irritability, option D shortness of breath. The answer is shortness of breath. Explanation: the severity of symptoms of caffeine withdrawal varies from individual to individual, and the most common symptoms include headache, fatigue, decreased energy, decreased alertness, drowsiness, decreased contentedness, depressed mood, difficulty concentrating, irritability, and feeling foggy. Shortness of breath is not a symptom of caffeine withdrawal. So, the most common symptoms of headache, drowsiness, irritability, feeling foggy, and shortness of breath is not a symptom of caffeine withdrawal. Fifth question. During cholera outbreak, the best emergency sanitation measures to be adopted is dash. Option A chemoprophylaxis, option B mass vaccination, option C disinfection of stool, option D provision of chlorinated water. The answer is provision of chlorinated water. Explanation: cholera is an acute diarrheal disease caused by Vibrio cholera, and it is transmitted from men to men by contaminated water, food and drinks, and direct contacts with infected person. If the cholera disease is endemic in nature, the best emergency management is boiling or chlorination. So, mass vaccination and disinfection of stool are also effective measures, but they are all long-term measures. It takes time to see the effect of these measures on population. But the emergency management is boiling or chlorination. Sixth question. A patient reports a change in urine color and attributes it to medication. Which of the following medications is least likely to cause urine discoloration? Option A sulfasalazine, option B amitriptyline, option C chloroquine, option D aspirin. The answer is option D aspirin. Explanation: medications such as sulfasalazine, amitriptyline and chloroquine are known to cause urine discoloration. But sulfasalazine can cause yellow discoloration, amitriptyline can cause blue or green discoloration, and chloroquine can cause a brown or black discoloration of the urine. However, aspirin is not typically associated with urine discoloration. So the least medication is aspirin. Seventh question. A 29-year-old female was brought to psychiatry OPD. She appeared agitated and claimed that her husband has stolen baby from her womb. Patient was also muttering to herself and has not slept for last 4 days. She had delivered a healthy female child 3 weeks back, however was not taking care of the baby. The symptoms started in second week postpartum. The likely diagnosis is dash. Option A postpartum blues, option B postpartum depression, option C postpartum psychosis, option D schizophrenia. The right answer is postpartum psychosis. Explanation: postpartum psychosis is a severe psychiatric disorder that can occur in some women following childbirth. It is characterized by symptoms such as agitation, delusions, for example, believing the baby has been stolen from the womb, muttering to oneself, and sleep disturbances. The onset of symptoms in the second week postpartum, along with the patient's lack of care for the baby, further supports the diagnosis of postpartum psychosis. So, postpartum psychosis is a severe psychiatric disease. So, symptoms like agitation, delusion, muttering to oneself, and sleep disturbances. The main important thing is the onset of symptoms in the second week of postpartum, and a patient may have lack of care for the baby. Eighth question. A 14-year-old boy has fractured his arm because of a fall from stairs. Following the application of a cast to the injury, the nurse recognizes the significance of conducting several assessments on the regional distal to cast. Which of the following assessment is least important? Option A, capillary refill. Option B, radial and ulnar pulse. Option C, finger movement. Option D, skin integrity. The answer is option D, skin integrity. Explanation. Assessments such as capillary refill, pulses, skin temperature and color are important for evaluating circulation and ruling out compartment syndrome in a patient with a cast. Assessment of skin integrity at this point is least important. Ninth question. A 32-year-old woman presents with lower abdominal cramping and pregnancy is confirmed by a positive urine HCG test and a pelvic ultrasound showing a 10-week intrauterine pregnancy. The patient expresses uncertainty about whether to continue the pregnancy. What is the most suitable next course of action? Option A, discuss the situation with the patient's parents. Inform the patient's partner about the situation. Option C, counsel the patient or refer her to an appropriate counselor. Option D, consider terminating the pregnancy. The answer is option C, counsel the patient or refer her to an appropriate counselor. Explanation. It is essential to provide the patient with the necessary support and information to help her make an informed decision regarding her pregnancy. Counseling can help the patient explore the feelings, discuss her concerns, and understand her options. By offering counseling or referring the patient to an appropriate counselor, she can receive professional guidance. That is most important thing in the counseling. 10th question. Which pathogen is responsible for causing ringworm and what is the primary mode of transmission for this infection? Option A, parasite, direct contact. Option B, parasite by waterborne. Option C, fungus by direct contact. Option D, bacteria by direct contact. The answer is option C, fungus by direct contact. Explanation. Ringworm, also known as dermatophytosis. This is a fungal infection of the skin. It is caused by various species of dermatophytes, which are fungi that can infect the skin, hair and nails. The primary mode of transmission for ringworm through direct contact with an infected person, animal or object. 11th question. After the completion of second stage of labor, the student nurse who was assisting in delivery for the first time observed lengthening of cord, sudden gush of blood and uterus becoming more globular. Student nurse immediately informed the registered nurse regarding the findings. These signs and symptoms indicate dash. Option A, primary PPH. Option B, baby is about to deliver. Option C, placenta separation. Option D, atonic uterus. The answer is option C, placenta separation. Explanation. The given finding like lengthening of cord, sudden gush of blood and uterus becoming more globular are the characteristic sign of placental separation. All other options is not related to given observation made by student nurse. 12th question. A 45-year-old woman is complaining of weakness, sleep disturbances, loss of appetite, reduced interest in work, and avoidance of social interactions with friends and relatives for the past 2 years. The most likely diagnosis for her is dash. Option A, somatoform pain disorder. Option B, major depression. Option C, somatization disorder. Option D, dissociative disorder. The answer is option B, major depression. Explanation. Major depression is a mood disorder characterized by persistent depressive symptoms, including changes in sleep patterns, appetite, energy levels, and interest in activities. The woman's symptoms of weakness, sleep disturbances, loss of appetite, reduced interest in work, and avoidance of social interactions are consistent with the criteria for major depression. 13th question. The nurse is caring for a patient diagnosed with an acute MI. The patient has severe uncontrolled hypertension. The BP is 190/110 mm of Hg. The nurse should question which of the following cardiologist prescriptions. Option A, give thrombolytic therapy. Option B, limit physical activity for 12 hours. Option C, provide supplemental oxygen therapy. Option D, administer IV nitroglycerin. The answer is give thrombolytic therapy. Explanation. Thrombolytic therapy is contraindicated in patients with a systolic blood pressure greater than 185 mmHg or diastolic blood pressure greater than 110 mmHg. The AHA, that is American Heart Association and American Stroke Association, advise against the use of TPA when systolic blood pressure reaches above 185 mmHg. Next question. After the delivery, insulin requirement of a diabetic mother will dash. Option A, decrease significantly, increase significantly, no alteration, insulin can be withdrawn. The answer is option A, decrease significantly. Explanation. During the delivery process, most of the glucose will be consumed as part of metabolism for energy production, which significantly reduces the insulin requirement in postpartum period. 15th question. Nurse was assessing a male neonate and observed urinary meatus was opening on the dorsal side of the penis. This condition is known as dash. Option A, phimosis. Option B, epispadias. Option C, hypospadias. Option D, cryptorchidism. The answer is epispadias. Explanation. Urinary meatus on the dorsal side is known as epispadias and on the ventral side is known as hypospadias. So the dorsal side is known as epispadias, ventral side is known as hypospadias. Then other options of phimosis is a condition in which foreskin is too tight to be pulled back over the head of the penis, and cryptorchidism is a condition in which one or both of the testes fail to descend from the abdomen into the scrotum. 16th question. The nurse is caring for a patient who is experiencing depressed mood, poor concentration, decreased sleep and poor appetite for the past 5 months. The nurse anticipates administering which of the following medications to the patient. Option A, mirtazapine. Option B, haloperidol. Option C, clonazepam. Option D, quetiapine. The answer is mirtazapine. Explanation. Mirtazapine is an antidepressant medication commonly used to treat depression. Haloperidol and quetiapine are antipsychotic drugs used to manage psychosis. Then the clonazepam is a benzodiazepine used as an anti-anxiety agent and sedative. So the mirtazapine is an Antidepressant medication commonly used to treat depression. 17th question. The patient arrives at the emergency department with the complaint of chest pain. The performs an assessment. Which of the following symptoms would be most characteristics of an acute myocardial infarction? Option A. Severe substernal pain radiating down the left arm. Intermittent localized epigastric pain. Sharp burning chest pain moving from place to place. Sharp localized unilateral chest pain. The answer is option A. Severe substernal pain radiating down the left arm. So explanation. The most common symptom of an acute myocardial infarction is chest pain, which is often described as a severe crushing pain that radiates down the left arm. The pain may also be accompanied by other symptoms such as shortness of breath, nausea, vomiting and sweating. 18th question. Doctor ordered visual acuity test for 1-year-old child. Which among the following nurse needs to prepare for visual acuity check? Option A. Any object which child needs to look and follow. Option B. Snellen's chart. Option C. Symbol chart. Option D. All of these. The answer is any object which child needs to look and follow. Explanation. 1-year-old child is not able to understand symbol chart or Snellen's chart. In order to assess visual acuity in them, nurse needs to hold any object in child's visual field and needs to check whether the child is able to follow any object or not. 19th question. Mass drug administration is related to which disease? Option A. Malaria. Option B. Filaria. Option C. Polio. Option D. Chickenpox. The answer is option B. Filaria. Explanation. Mass drug administration, that is MDA, is the administration of treatment to every number of a defined population living in a defined geographical area, except to those for whom the medicine is contraindicated, and approximately the same time and often at repeated intervals. Mass drug administration is also given to malaria in many countries, but in India it is given only in case of lymphatic filariae. 20th question. A 32-year-old woman who is 12 weeks pregnant has recently been diagnosed with an autoimmune disease. Which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? Option A. Immunoglobulin A. Option B. Immunoglobulin D. Option C. Immunoglobulin E. Option D. Immunoglobulin G. The right answer is option D. Immunoglobulin G. Explanation. The essential for maternal immunoglobulin G to provide an immunoglobulin infusion to the fetus during the 3rd trimester. It requires that the dose remains sufficient to maintain an adequate plasma immunoglobulin G level in the mother during the pregnancy. 21st question. Nurse was instructing a group of mothers how to encourage autonomy among their 4-year-old child. Which among the following statements identified by mothers indicate that session was effective? Option A. Help them to button the dress and tie the shoelace. Option B. Let them select the dress they need to wear. Option C. Tell the child whenever they did not dress well. Option D. Give instruction to them regarding cloth selection. The answer is let them select the dress they need to wear. Explanation. If child is allowed to select dress for self, it will boost autonomy and self-esteem. Other options are discouraging autonomy and self-esteem. 22nd question. During assessment of a patient, the nurse asked the meaning of strike when the rod is hot, and the patient replied, "It means that you should strike when the iron rod is hot to melt it because it is the most malleable then." What aspect of the patient thinking is demonstrated? Option A, abstract thinking. Option B, concrete thinking. Option C, content of thought. Option D, form of thought. The right answer is option B, concrete thinking. Explanation. Concrete thinking refers to understanding of literal meaning of a sentence or proverb. In this case, the patient's reply demonstrates the direct and literal meaning of the proverb. Abstract thinking refers to the deeper meaning of a sentence or proverb. For example, a person capable of abstract thinking would have answered the metaphorical meaning of the proverb given in the question, which is to take action when the opportunities are favorable. 23rd question. A 32-year-old primigravida woman admitted in OBS gynec department due to preeclampsia. The woman has a history of diabetes mellitus. Which of the following actions should the nurse take first? Option A, closely monitor the blood pressure of the woman. Option B, prepare the woman for childbirth. Option C, ask the care provider to prescribe calcium supplements. Option D, administer low dose aspirin as prescribed. The answer is option B, prepare the woman for childbirth. Explanation. The preeclampsia is a serious condition characterized by high blood pressure and organ dysfunction during pregnancy. It can be life-threatening to both the mother and the baby. The only definitive treatment for preeclampsia is the delivery of the baby and the placenta. So, given the woman's diagnosis of preeclampsia, nurse's priority should be to prepare for her childbirth. This may involve notifying the physician, arranging for necessary interventions such as induction of labor or cesarean section, and ensuring that the delivery environment is ready to provide appropriate care. That is the major role, that is the most important role for nurses for this case. 24th question. Mr. Jagdish, 47-year-old male, is admitted in ortho ward with a fracture of right leg. Suddenly complains of chest pain and dyspnea. His BP is 85/50 mmHg, pulse rate 124 beats per minute and respiratory rate 24 breaths per minute. Which of the following initial assessment should a nurse perform to diagnose the condition? Option A, take a sample for ABG analysis. Option B, obtain a chest X-ray. Option C, auscultate the lung and heart sound. Option D, prepare the patient for pulmonary angiography. The answer is prepare the patient for pulmonary angiography. Explanation. From the given clinical scenario and manifestations, client is experiencing pulmonary embolism as a complication of fracture. The best diagnostic test for pulmonary embolism is pulmonary angiography. 25th question. A nurse is formulating a nursing care plan for a newly admitted patient with left below knee amputation. While formulating the nursing care plan, the nurse found two nursing diagnoses closely similar to each other. How will the nurse recognize which diagnosis will most accurately reflect the patient's need? Option A, reassess the patient condition. Option B, both nursing diagnoses can be utilized. Option C, review the defining characters. Option D, all of the above. The answer is option C. Review the defining characters. Explanation: the nurse should review the defining characteristics associated with each nursing diagnosis to determine which one accurately reflects the patient's need. That is very important in nursing diagnosis. By carefully examining the defining characteristics, the nurse can differentiate between the two closely similar nursing diagnoses and choose the one that aligns best with the patient's specific condition and presenting symptoms. Okay friends, I hope this video is very useful for you. All the best for your exams.